there's a brain fog and cognitive component where people can't sustain attention, and it's not because all of a sudden they have developed new ADHD in their adult life. It's because something's going on visually that's not allowing them to sustain that focus.
Are you ready for a show that actually shifts you? With real, raw, honest conversations about what it takes to become the most embodied version of yourself. And are you ready to remember that the world really does need your medicine? This is the podcast to awaken that. I can hear a calling. Because we all feel our higher self pulling us to our next expansion. But the only way to really get there is by sharing our stories together. So welcome to the World Needs Your Medicine podcast. This is the place where we can have real conversations about the things that have worked for us, the lessons we've learned, the hard struggles along the way, and the things that have shifted us into the versions of ourselves we are now. Here on the show, you'll hear from some of the most incredible guests that have transformed their lives using the exact tools they talk about and offer inside each episode. I'm so honored to share this with you, and I can't wait to dive deeper, because when you see the power of what others have created, you believe you can create it too. And that's all we are really trying to remember, because the world really does need our medicine, and it starts by finding it within yourself. I'm Lauren Eliz Love, and let's dive into the show. Thanks for being here. Oh, what is up, my lovebirds? Welcome back to the show. Here we are. I'm recording intros now on camera because we have decided to move all of our beautiful, magical interviews into YouTube so you can actually put them up on the screen and watch the conversation, which I personally am not really a fan of, if I'm being honest, because I don't like to get dressed when I'm being creative. I feel like in the times where maybe you can relate to this, the times where I'm recording interviews, I'm excited. So I'm going to get dressed cute sometimes, only you'll find out hardly ever. But anyway, when you're with people, there's a motivation, to get dressed nice and put together. And oftentimes when I'm recording my intros, I'm cozy. It's the morning time. I'm in my own little personal cocoon bubble, and I haven't even brushed my hair yet, and I just want to be able to cozy up with you and say hello and not put any pressure on myself. But now we are on YouTube, and that always, does a thing to us as women. But I'm over it. I'm just going to show up as me. Hi, I woke up like this, literally dropping in with you guys to record today's conversation. I'm in a very interesting time in my life, and I feel like a lot of us are. What's unfortunate about this particular intro is that I'm very early recording this. It is not going to be live and available for a couple of weeks, but as I'm recording all of this, I'm building a lot of organization in my life. That is the theme, that is the energy, that's the focus. I am tired of wasting time. I don't want things to take long. My energy is precious. Maybe this is the fact that I'm in perimenopause, and as we shift into this season of life, I think we really start asking these questions what do I want for my life? What do I actually want? What's important to me? And I just don't want to waste any time. I want to have opportunities to be in nature a lot and peace out. And as you can hear, I'm tired. I'm tired. So I've been streamlining a lot for business, and I've been looking into all of these fancy new tools that I can utilize, like Cloud and Claude, I think it's actually called. ChatGPT. My mom was so funny. She's like, Lauren, there's this thing. I think it's called ChatGPT. And you can use it. It was so cute. But I'm like now looking at Claude because I see that there's like coding abilities to make my life more efficient. And so I'm sharing all of this because in this time, as I'm yawning with exhaustion just thinking about it, I have been spending a lot of time in front of the computer and my eyes are not doing too well. And that's okay because I'm learning. I'm learning how to like really prioritize my eye wellness. And I feel like this conversation it was really eye-opening, no pun intended, and very inspiring for me. I have my sister on the show today, guys. Dr. Katherine Cioffi is on the show, and she is an eye doctor. And we were talking, the reason that we had the idea to like bring her on the show is because she and I on family vacation, which if you didn't listen to that episode, go back and listen. Family vacation episode was wild, wild conversation. But she and I had this beautiful moment in person where we were talking about our work and I was asking her these questions and I'm like, oh, you're like in the trauma field and you don't even realize it. I mean, she realized it, but like I didn't realize it. So we started to have this conversation about our eyes. And the reason I was so curious about this was through my study of the nervous system, recognizing that our eyes are a huge player in the game of nervous system regulation. It's why EMDR is such a powerful and effective modality. So I wanted to bring Katherine on the show to kind of talk about, eye wellness and the correlation to our nervous system. So in this conversation today, you are going to meet my sister, Katherine Cioffi. She's a very fancy bio, so I'm going to pull this up. She's a leading neuro-optometrist. Okay, so this isn't just about the eye, it's about the eye-brain connection. She's the director of vision therapy at My First Vision in, I'm not going to say this right, Bethesda, Maryland. She focuses on rehabilitation and has had some really impressive fellowships in some other places, but her work now primarily focuses on training the eye-brain connection to help patients of all ages unlock their potential through vision, which is such a beautiful thing. So I bring her on the show today. We have some juicy conversation. We talk about all different stuff, the ways in which we can improve our eyes over time. We talk about the difference between eyesight and vision and why this language is very important to understand the difference between. We also go into nervous system regulation, practices that you can do at home to do eye push-ups, as she calls it, and just teaching us how to, create really strong wellness. What was really cool about this, I really wanted to have her come talk because we also had another guest on the show back a while talking about ADHD and understanding that diagnosis. And also, Katherine on the show talks about how sometimes that diagnosis is actually caused by the issues that she sees in her work. So I just really want to say, go back and listen to Family Vacation episode. Go back and listen to the beautiful conversation we had about ADHD with Jenny, one of our former guests. And if you have a child who has this diagnosis, really highly just encourage you to watch the show today. And also, of course, I ask her about blue light blocker glasses. I had to. We got to bring the biohacking energy in. Really want to know, does this stuff work? What do we need to know? So here we go. Let's dive in. Welcome, everybody, to my gorgeous, beautiful sister, Katherine. So much. Thank you. So much. Thank you for being on the show today. And I'll see you guys on the other side of this one. In 5, 4. You know what's really funny? You are the first. I was thinking about this on my walk today. So this show is called The World Needs Your Medicine. And I was like, this is the first actual doctor that I'm having on the show.
Perfect.
I know. I'm so excited. But it made me a little insecure because I was like, oh shit. I got to ask the right questions, be all profesh. But guys, this is my sister, Katherine. Katherine, welcome to the show.
Thank you for having me.
Yeah, I'm so
cool to be
excited.
here.
I know. Is that, wait, I just have a question. On the desk behind you, that eyeball that's by the frame, yeah, is that looks like a third eye?
A lot of our office is Grease themed, so we have a lot of evil eye action going on. So
Nice.
similar vibes.
Yeah, I think that's kind of fun. I have evil eyes everywhere, but it's for a different reason. You're in an optometry's office.
Right. Different uses. And you can see there's one up here too.
Yeah, I love it. The eyes are watching everywhere. Is that
Correct.
something that happened for you when you became an optometrist? You just wanted to wear a lot of eyes?
Absolutely. It's like at stores. I don't know if it became a fad at the same time or I just started to notice it more, but eye earrings, eye necklace. I have so many optometry related earrings, and patients get excited by them. So I get excited by them.
So you work with kids, but you also work kind of in like, I guess we could use language like rehabilitation. Maybe I was the first time I ever asked you what you do, I was like, wait, I did not know this. Can you remind me? And let's talk. What does Catherine do? And explain it like a 2-year-old so that everybody can understand, including myself.
So the 2-year-old version is that I specialize in the eye-brain connection, and that relates in vision rehabilitation, but we call it vision performance training, and that affects adults and kids in different ways. And there's kind of three, I would say there's three populations we see. One is kids who have developmental issues that didn't develop their proper eye skills as far as teaming, focusing, tracking. The second is someone whose proper development was disrupted by some sort of injury or trauma, which it sounds like we will get into more. And that is often adults, but can be kids too. And then there's actually this third tier that's people who don't have problems from what they can tell, but want to optimize or kind of biohack their health, and vision is a part of that. So that's like the three demographics that we see.
Yeah, and I think we'll get into that third piece too. Let's start with the kids kind of umbrella because I know we do have like a lot of moms listening as well. You used language, you said tracking, training, and also what was the third one? Focus?
Teaming, focusing.
Teaming. Yeah, so explain those concepts first. I feel like we need to kind of introduce language here before we
Definitely.
actually start going into like all of the pieces of approach. So yeah, just explain that to us, to the audience.
Yeah, something I always talk about with patients and even in situations like this on a podcast or a talk is taking a basic and actually talking about vision versus eyesight because those terms are often used interchangeably, but they're not the
Well, yeah,
same.
they're not the same.
Eyesight, they're not. Eyesight, you'll hear people say, I have 20/20 vision, but that's not really correct. That's 20/20 eyesight. So eyesight has to do with our ability just to see things far away, read that small letter chart, see those street signs. That has to do with our prescriptions, our glasses and contacts. But when it comes to vision, there's so much more involved. That's how our eyes move together to track, to converge, come in together, to focus, keep things clear, and also process information that we're seeing, make sense of it, and direct the appropriate action. So when we talk about eyesight, that's really glasses, that's symptoms. But when we talk about vision, vision is brain. And when we have vision problems, that's really brain problems. So that distinction is important when we come into it here.
Yeah, you said something when we first. So, guys, just so you know, my sister's so super cool. This is why I wanted to have her on the show. We started to talk about all these different things, and I was getting curious and I was asking questions, one of which was around ADD. I believe we started to talk about some of the patterns of the mind and the brain and how ADD patterns also have visionary components of issue. Can you speak to that a little bit? Remind me what we said or what you said that I was like, oh, yes.
Yeah, so ADD, ADHD, even things like dyslexia, the symptoms have such a huge overlap with vision problems. And again, vision problems, not eyesight problems, where it can be maybe we can't keep our focus on a page or we keep losing our spot or the words look like they're moving. Some people will put it into that camp, give them that label, maybe even give them that medication or intervention, extra help at school, but not assess the eyes. And the take home with all of this is if we cannot focus our eyes, how can we focus our mind? So being
Hmm.
able to keep things single, clear, follow it appropriately, if none of those things are working in synergy, then it's going to really affect our attention. And this can also leads into what we'll talk about later with trauma, because there's a brain fog and cognitive component where people can't sustain attention, and it's not because all of a sudden they have developed new ADHD in their adult life. It's because something's going on visually that's not allowing them to sustain that focus. So
Hmm.
those diagnoses you mentioned, ADD, ADHD, they are incomplete without having a proper visual assessment. And again, not just checking the eyes are healthy and that there's no prescription, although that's important, but checking the functional vision skills.
Yeah, how these functional vision skills that we, I guess, just kind of assume are natural, right? Like we're born and we just know how to use our eyes. Can that's not the case all the time, right? Like, so what causes that inability to not have your eyes pair properly or to not be able to track even like as a young child? I know we'll get into trauma later, but yeah, what are some of the causes of that?
So there is genetics that play a role. If there's someone in the family that has a lazy eye turn, then you can be more likely to develop it. But the biggest piece is the environmental factors. And one is developmental milestones, specifically when you are really young and you're learning to reach and crawl and use both sides of your body. So somebody
Mm,
who skips crawling or crawls late, they didn't get that what we call bilateral integration. When you crawl, you move your right hand and your left leg and you're switching and you're looking and reaching for toys across your body. That trains the brain to use both eyes together to team but also to track properly. So when that doesn't happen, that can make it more likely to have eye issues. And definitely screen time is a big thing, for the same reason. If you're giving a 2-year-old a tablet and they just watch it, again, they're not being dynamic in their visual space, reaching, playing, and those things can affect development and visual skills wise.
yeah, I was reading a book. A few of my friends and I were in this book group and we were reading about the nervous system and, you know, the nervous system being made up of multiple systems, right? It's not just like the nervous system. You have the vestibular system. You have all these different types of systems in the whole hub of the nervous system. And when we look at understanding a healthy nervous system, one of the functions is proprioception, right? That's the language we use to
Right.
be able to have awareness of what is around you and how far away you are to certain things, right? Am I getting this
Yep.
right? Like the proprioception of our world,
Yeah, and tactile feedback.
tactile feedback. But you're also talking, interestingly enough, about bilateral stimulation, which also in nervous system, we talk about that all the time with concepts like EMDR, which, you know, is
Yes.
this is a part of it too. So I want to go into a million different directions with this conversation because I feel like there's so much we have to cover. Is there a topic that's alive for you right now to speak on before I start steering us where we're going to go next?
Yeah, I mean, I would love to talk about the trauma piece because that is such a big part of what I do, but it is also a big part of what you do. And like you said, being sisters and talking about it and realizing, hey, our jobs are actually really connected and we didn't realize. So that's what lights me up to talk about, but I'm really passionate about my job, so anything you bring up, I'm sure I would be excited to
Yeah.
speak on.
No, I'm so pumped for it. And the backstory too, I kind of feel like is a really beautiful one. Like one of the things I really admire about you, I'm just going to like take a minute to honor you. You know, my path of following my purpose was about going completely outside of the traditional realm of everything. You know, like I'm just going to go this way. But
Right.
you also like so beautifully in your life you followed your purpose becoming a doctor as an optometrist. This was something that you kind of knew you always wanted to do at a young age. And I feel like that's really important to showcase for our community that, you know, being in your purpose and honoring your medicine and being in your gifts is not always about breaking out of the construct of the 3D world, but about leaning in. So, can you share before we go into the trauma stuff, like how you followed the path of becoming an optometrist and how that passion kind of birthed for you in your life?
I love this question. When I look back at it, it's kind of crazy, but I got glasses for the first time in fourth grade. Nothing crazy going on, but it was affecting school, and it was something that we kind of realized. Mom cried, all of that good stuff. And I was like, oh, the eye doctor was kind of cool. And Mom swears I said, I want to be an eye doctor. I don't really recall it, but in, in seventh grade, I got contacts. And if you know, you might not know, when you get contacts, you have to do a whole training class of how to put them in, take them out. And I'm with the technician, and they're about to work with me, and they explain it, and I just like popped it in, and I said like that, and they were like, oh, like they allotted a whole hour of training, and it just came really naturally. So maybe I should have known that. But later on in life, I realized how much more there was to optometry than glasses and contacts, and specifically this piece of helping kids and adults and how it relates to the brain. So it was kind of combining things that I found interesting. And once I got into school and learned about vision therapy and vision rehabilitation, then my mind was set on that. And I, did residency, and I did my fellowship, and just want to advance my knowledge as much as possible. And then I've been at this job for the past 2 years, helping a lot of people of different walks of life, and it's been awesome.
Yeah, it's cool because like when I tell the story sensationally, I'm like, mom always tells it too. Like mom was crying because you were in the fourth grade, and it was now we were realizing, oh my God, Katherine has not been able to see for 10 years of her life, like just really foggy. But yeah, vision is a really important thing. So yeah, let's get into it. I want to unpack some of my trauma. I have questions. I want to like really come to understand like the role that our eyes play with things. So let's navigate this concept of eyes and focusing. I want to start with that, and I want to go into the trauma stuff and see what comes up. So for me, I notice that when I am on, and I don't know if this is a trauma response or not, but when I'm doing a lot of overworking, like I'm disrespecting my body wants to rest, I'm really tired, but I'm staring at the computer screen for more hours. I will be here looking at your face, and I will literally stop focusing, and my whole brain will separate from focusing. And then I find myself having to like squinch my eyes and like reset and come back to pay attention and make my eyes focus, and I can't. And I don't know if that's like screen related or trauma related because I'm pushing my body outside of its comfort zone. Dr. Cioffi, what would you do with that?
So when we talk about our focus and our nervous system, we think of there's a polyvagal theory that says there's more than two, but just for simplicity, we have our parasympathetic, which is rest and digest, and then there's sympathetic, which is our fight or flight. So things that trigger our sympathetic nervous system affect our visual system intimately. And when we're triggered from inflammation, from infection, Lyme disease, long COVID, concussion, stroke, those things come into play. But we've also found that mental stress, psychological trauma can manifest in the same way. And what's so cool about vision is it's one of the most accessible ways and windows into our nervous system. And you mentioned about EMDR in that we can use vision to help regulate our nervous system. But in the same way, the way that someone sees the world reflects the state of the brain. And a dysregulated nervous system is going to change the way the world looks and feels and how we can process it. So what you're talking about, whether it's triggering a trauma response or causing stress to your system in a different way, the response is the same. And it's all about the fight or flight. When we're in sympathetic mode, it's survival mode. Our system in general wants to say, am I safe or not? Mm-hmm. And how that manifests into vision is our pupils get big, our peripheral vision goes. We actually have more like tunnel vision, and we're trying to spot and scan the enemy in the distance. So if you're thinking about caveman days, we're trying to spot that danger. And this is affecting our ability to focus up close, because focusing, keeping things clear, teaming up close, that's actually all parasympathetic. Because if we're being chased by a bear, we're not going to look at something close and read a book. So being in a permanent survival mode or having that survival mode triggered is what causes those skills to go out of whack. And we need them to be balanced to be able to function, especially in this world where we're on the computer and doing more up close work than our system and our creator initially designed us to be. Our eyes weren't, and our visual system weren't designed to be on the computer 12 hours a day. So even someone who doesn't have those issues probably experiences that fatigue after however long they meet their limit.
So what I'm hearing, and I just want to make sure I'm understanding all of this properly as we're having this dialogue. So how we feel internally affects how our eyes work, but also how our eyes work affects how we feel internally. So can we essentially biohack our nervous system? Like, so when I took this somatic course years ago, one of the ways we would always start the course was with grounding, and we would look at things in our environment, and she would train us to say, scan the room from left to right and see what you see and notice what you see, right?
Yeah.
So that's making me think, can we train our eyes to actually impact how we feel internally to be more regulated in a parasympathetic state?
Absolutely. And that's a lot of the cool stuff we see. And whether it's our primary goal or it's a cool side effect, it happens all the time. And in one way, it can be if the visual system is causing stress, treating that helps our anxiety and stressors that way. But also if we have inflammation, trauma, stress to the system that is affecting our vision, trying to expand our peripheral focus and work on our eye teaming and all of those things, it can have a positive effect in that way too. And one of the treatments that we use actually is called optometric phototherapy, where we use a specific wavelength of light to try to balance out the nervous system. So in these cases, they look at usually a blue or green color because that is on the parasympathetic side of the spectrum. And that's something that we prescribe for a lot of our patients to just look at this light.
Okay, wait, when am I coming? Sign me up.
To come for an
when am I coming?
Come for a week-long program would be.
I would love that. Yeah, I'm totally down. I'm open to trying. I will try anything to help support my nervous system, except the one that's a total no for me is I don't know if you've ever seen anything about it, but it's like dark therapy where you go in a cave in the dark for like 4 or 5 days. And I
yes, I've heard of that.
That's a no. I feel like that fucks up your eyes. Doesn't that not fuck up your eyes? You're in the dark for 4 or 5 days.
I don't have experience with it directly, but what I would assume is when you first get out, you're going to be really symptomatic, really light sensitive, and have those kind of same responses. So I don't know if it like takes a little bit to shift. But that's not something I personally recommend.
I don't think that's supportive for me.
But I'm sure that there's patients of mine that have tried that. But it's a little, we're speaking of caveman days.
Yeah, that's why I thought of it. Yeah, totally came up for me. So, okay, so trauma, we're learning a lot here. I love this. I love when I can bring a guest on and I feel like I'm walking away like more knowledgeable about things. So if for somebody at home who is saying, like, yeah, I really resonate with this, Kat. I really want to know, like, can I have some certain practices? You know,
yes.
Yeah, what do you suggest?
I have a lot of tools. Something more formal just to mention is we do have an online program called Screen Fit. It's a great starting point. You'll get a discount code that we'll put in the info. But there's things we can implement, like, right this moment. So anyone who's doing up close work, every 20 minutes we should be looking at least 20 feet away for 20 seconds. That's the 20-20-20 rule.
Wait, say that again. So every 20 minutes you look away 20 feet for 20 seconds?
Correct. Relaxing those eyes. Because if we're staying so engaged up close without relaxing, that's going to cause more stress to the system.
Should I get like a little timer on I feel like I should get a little timer on my desk.
Yeah, get a timer. Put a little sticky note, something like that, especially for those who are working up closest, like the majority of their job. It's really important. And another activity I can teach you right now, I can teach you 2 activities.
Let's do it. Teach me all the things.
So one is called peripheral point. We're going to cover an eye.
Oh boy.
And we're going to look straight. You can use, why don't you use my eye as your focusing point?
Okay.
Okay. So I want you to spot something in your periphery, anything that's kind of far out to the side. Can you name it?
Yeah, I can. It's the little statue on the upper right shelf.
Okay.
But I'm still looking at you, but correct. I'm like, okay.
Still engaging with me. I want you to put your finger where you think exactly that is.
Okay.
And then I want you to look at your finger and see how you did.
I did good.
And then you're going to try it again in the temporal side, the part towards your ear.
The part towards my ear? Okay, but yeah, wait, like this ear or this ear?
Yeah, because you found one that was close, more across you. Like
yes.
That's what you did. So now do something that's on your outside.
Okay, on the outside?
Yeah, like that purple pillow or something.
The purple pillow. Oh, that thing over there?
Yeah.
The purple pillow. Okay, so I'm supposed to look at you, but I have to see. Ah, I see. Okay, so I'm looking peripherally. Yeah, and now, oh my God, this is trippy. Okay.
And then try to put your finger right on it, and then check and see how you did.
I did really bad.
So
that's really bad.
So what you would do is make a note of that and then try again. And you're kind of doing that in the gazes this way and this way with both eyes. And that's to try to expand peripheral awareness because like I said, the fight or flight, you get that tunnel vision. So opening up our periphery is going to help with that. Even things posturally, big exhales, feeling more relaxed, those things also help. And then our other activity will do our near far focus, or sometimes my boss, Dr. B, calls these eye push-ups. So I want you to cover an eye again. We do one eye at a time in these ones.
I'm going to do the good eye first.
You can switch. And I want you to look at your finger and make your fingerprint really clear. Is it clear?
Make my fingerprint clear.
Yeah. Is it clear? Can you see all the details?
Yes.
I want you to slowly bring it towards you until it gets blurry.
Yeah.
And then try to make it clear. Can you?
No. Maybe.
If you can't, back it up a little bit.
Okay, yeah, now I can.
Okay, so now you're going to hold that clear for 5 seconds. You should feel a little more tension in your body, a little more focus. And then I want you to switch your eyes to look far, at least 10 feet away, and take a big exhale. And then after 5 seconds, you would come back to your finger
and do it again.
So we're contracting our focusing system, and then we're relaxing it. So we're gaining flexibility of that system.
Well, this is really interesting because a lot of my trauma response, like when we went on family vacation, it's a bracing. It's always this like bracing energy of like what's going to happen, something bad is going to happen. So the contraction that you're describing in the eye, like that's really interesting because my body contracts. So that would make sense that my eyes would do the same thing. Huh.
Yeah, so you want to make them more flexible so that they're able to focus, but they're not stuck focusing, which is the same idea of the 20-20-20 rule of relaxing, looking far. So those are some easy ones to implement.
Do you think that in all of your experience now, being like so devoted to this path of passion around the eyes and eye wellness, like, do you think that the health of an eye is like, how do I put this? It affects others. Like, how important is it? I guess was what I want to ask. Like, how important is our vision for our gut function or for our other systems as well, not just the nervous system itself?
So our visual system doesn't exist in isolation. That's what we've learned through this brain talk. So anything that's going to promote the health of the brain is going to promote the health of our vision. So when we talk about nutrition and supplements and things like that, it's all about reducing oxidative stress in the brain and having it function super well, because that's what's going to have the visual system function super well. It doesn't quite work the other way as far as like if your eyes are bad, it's going to make your nutrition bad.
Right.
But promoting health of your whole system and your brain helps with your vision, even clarity.
Like, when I had the Lyme disease the difficult time of it, like I had my eyes had such a hard time. I was like very light sensitive. I had a very difficult time focusing my eyes. I was always like unable to like pay attention and attune. So, yeah,
That's
in that,
exactly what we talked about.
yeah, I mean, it's all making a lot of sense as we're having the conversation. I'm wondering for like the practice of good eye care, do you suggest like the blue light blockers? What is your opinion on that? Because, and let me elaborate before you form your statement. So there are like blue light blockers. When you get regular glasses, they ask, do you want the blue light in them, the blue light blocker in them? And you pay extra and they're in. But then you
Right.
can also get like the glasses with like the yellow tinge or like
Yes.
the red tinge, and like what's the difference? Do these things actually benefit any aspect of our eye wellness?
This is a great question. It's also like a hot
Yeah, yeah.
topic in the biohacking field. So my glasses have blue blocking in them. They don't have that amber tint that you're talking about. So there's a percentage of blocking in mine versus the full blue blocking is going to have that dark tint. It can alter your color perception and things like that. The benefits of these glasses is that it's going to block the harmful blue light that's coming from screens and how that can relate to our eye strain. But something else we know about blue light is it affects our circadian rhythm and our sleep through our melatonin release. So if we're on devices and things like that later at night, a more intense blue blocking can be helpful to combat that. But we also get natural blue light that is good from the sun. And not all
Oh.
blue light is bad because
Oh.
going outside and that blue light telling your brain, hey, it's daytime, that's what keeps that circadian rhythm in cycle, which is why people have issues with sleep during winter and seasonal depression and like all of those things. It's all about the sun. So we want blue light in that way because it's telling our body what time it is and what hormones to secrete. But when we're having prolonged exposure or later at night, that's when a more intense blue blocking can be helpful. The bigger ones, they do affect your color perception a little bit. So I don't find them as functional personally, but some people are different, especially if they're really sensitive.
Yeah, so like when I go through airports, I tend to try to wear some sort of sunglass in some capacity. I have like the red light ones, the red tint ones, so I will put those on. But then I also have at night a tendency to use those a little bit more, and I do find it helpful for my own sleep. But
Yeah.
I guess it's like, why is it a hot topic in the biohacking world? Or some people like it doesn't work.
Yeah, there's some people that think it doesn't do anything. And also, there was actually this study, not necessarily about blue light, but about UV protection, that you were more likely to get sunburn if you were wearing sunglasses, which
What?
was super interesting. Like sunburn elsewhere, not by your
Yeah.
eyes, but just in your body. And when you think about it, it does make sense because, again, your eyes are not getting that cue to tell your brain, hey, protect my skin because there's sun.
Oh.
Doesn't mean you should go and stare at the sun and not wear sunglasses, but if the sun is not like directly in your eyes or things like that, it could be beneficial to not wear them. I love sunglasses more for the fashion piece, but it's something to think about, again, about the eyes communicating with the brain and body and how that affects us.
Okay, so one final question before we sign off, because I could talk to you
Sure.
forever.
Yeah.
When you have people come for like this week long intensive, so everybody listening on the podcast, you guys can go. Catherine and I are going to talk about me coming, but yeah, tell me about like what is it? It's a week long intensive. What do you do?
So our intensive program includes 12 sessions of therapy in a week or in 5 days, 50 minutes apiece, plus an initial evaluation, your progress evaluation, and then 3 months worth of follow-up care once you're not here anymore.
Wow.
And our exercises are trying to optimize and improve the teaming skills, focusing skills, tracking skills, and even visual processing of our eyes and visual system. And each day things are loaded. We're adding vestibular input and cognitive loading and just really getting the system to be really integrated in how it relates to your goals and your symptoms. And people come from all over, which is super cool. We have local patients that come twice weekly, but not everybody lives in Bethesda, Maryland, or close enough to drive. So we try to make that accessible that way. And
That's
like I said, we do
cool.
support 3 months afterwards with our home virtual reality and other home exercises to build off of all the improvements we make in a week. But it's really crazy how much people improve in just 5 days because of this intensive work. It's like a boot camp.
Do people cry and have like emotional releases when they're doing this?
Absolutely.
Really? Okay, maybe this is next on my list. Instead of ayahuasca, I'm just gonna come into eye therapy session.
I mean, no pressure. You might not cry, but a lot of people can feel release from an exercise where we make a breakthrough of learning what to do with our eyes, but they can also have emotions from seeing the progress or even starting to see changes during the week, which is so cool.
It's beautiful. Yeah, I'm so grateful I had you on the show, Katherine. Thank you so much.
You.
And for everybody, we're going to do a little Sig Out special reference at the end of the show. Stick around. I mean, what? Like such a good conversation. It's so good. I was so impressed with her, just the way that she carries herself, the way that she talks about her work, her passion. It was so inspiring to have her on the show. Man, I'm so happy that we got to do this. It's cool because, Katherine and I bond in so many ways. We very much relate to some of like the the qualities of a woman who's very passionate in her work, and you could see that in the show. It's just really cool. And I love bringing people on the show who are so passionate about what they do, and what they're doing is really helping people. So it's really, really cool. If I end up going down to Maryland, I'm definitely going to catch you guys and share and, give you all the updates about the journey. So stick around. And I invite you to go check out the 2 referenced episodes we shared about in this one. We talked about, come listen to Jenny's episode about ADHD, and also go back and listen to my personal one about family vacation. I think I titled that one Healed Daughter, Unhealed Family, and is a really, really juicy one. So thanks for being here on the show. For more on Dr. Katherine Cioffi, you could see the show notes of this episode. She has a link with a coupon code for you to take the online programs that her office offers to improve and strengthen your eye health. Thank you guys. I'll see you on another episode very soon. Ciao, ciao.